Hi, so I chose to do my presentation on kidney cancer, and I'm first just going to start off by giving a brief overview on the anatomy and physiology of kidney cancer, or the kidneys. So move on to the next slide. So everybody has two kidneys, one on the left and one on the right side of the spine. The right is a little bit lower because the liver is right above it, superior to it, and it's pushing it down. Both kidneys have all the same structures. They're basically symmetrical. I've only listed a few of the structures just for the sake of space and time, but just know that there are many other structures within the kidneys that are responsible for the functioning. So kidneys have a renal capsule, which is a thick fibrous outer membrane, which is responsible for protecting the kidney from any trauma. They also contain a renal cortex, which is the outer region of the kidney. This is where erythropoietin is made, which is responsible for red blood cell production, and this is also where a majority of the nephrons are found in the kidney. Renal medulla, this is the inner region of the kidney. 8 to 12 renal pyramids are found here, which are responsible for creating urine. The renal medulla is also where the kidney's main functioning of filtration occurs. So more structures. Kidneys contain an adrenal gland, which sits right on top of the kidney, and it releases cortisol and aldosterone. The adrenal gland is really active in monitoring certain bodily processes such as blood pressure or blood sugar. The renal artery is what separates the aorta from the kidney, and it brings waste to the kidney to the nephrons through, for filtration. The renal pelvis is where all of the urine pools together before it is excreted, and the renal vein kind of serves as like a highway from the kidney to the inferior vena cava, so the blood can then be recycled and reused. Functioning, like I said, the main functioning is filtration, filtering any waste from the blood and secreting it through urine. The kidneys are also involved in maintaining an electrolyte balance, and as well as controlling the amount of fluid in your blood, which then impacts blood pressure. This is affected by how much salt is retained or how much salt is excreted. And like I said, the kidneys are responsible for producing erythropoietin, which triggers red blood cell production. Moving on to kidney cancer. So kidney cancer occurs when in one part of the kidney, cells just rapidly multiply and a tumor is formed. This tumor can be benign or it can be malignant, just depends. I've listed a few types of kidney cancer. The most common type is renal cell carcinoma. About 50 to 60% of incidences is this type of cancer. This actually occurs in the proximal renal tubules, which is a section of the nephron, which is responsible for filtration. They also have, there's a sarcoma, which is very, very rare. Wills tumor, which is also really rare, more found in children, so you're not really going to find it in adults. On lymphoma, which is present in the lymph nodes. There are numerous types of kidney cancer cells. Each, depending on what type of cell you're working with, it'll depend on what type of cancer you get. So the most common type of cancer cell is clear cell. This is in about 70% of the diagnoses, and it can range from being very severe or to being really benign, or not benign, but not as severe. So grade 1 to grade 4. There's also papillary, medullary / collecting duct, chromophobe, again, just depending on where these cells are multiplying. So for the diagnosis of kidney cancer, a lot of times patients will experience some sort of sign or symptom, such as hematuria, which is blood in the urine, or they may feel lower back pain on just one side. They may have rapid weight loss that isn't caused by dieting. They may have no appetite anymore. All these are telltale signs of cancer. So if a patient goes and tells her physician about all of these symptoms that they're having, a lot of times they will, if they view necessary, they will conduct a urine analysis, which basically just screens the urine for any blood, which a lot of times can be seen with the naked eye. Diagnosing kidney cancer differs from other types of cancers in the way that it can be diagnosed just through imaging, whereas other types of cancers such as liver or of any other type of organs, they'll need a biopsy. But for kidney, a lot of times you can just do like a CT or a PET scan and they'll be able to diagnose. Depending on the severity of the cancer, the type of cancer, where it is, and risk factors, the treatments will vary. Most common including chemo, immunotherapy, radiation, and surgery. And a lot of times people will combine these treatments in order to optimize their chances of survival. So side effects of the treatments vary, but as you can see, immuno and chemotherapy and radiation do share some, such as fatigue. So it's seeing all these side effects, it's really important when you're making an exercise prescription to take into account potential side effects that the person may be having, because some patients experience a lot of really bad side effects and some face none. So it really just depends. Symptoms of kidney cancer, like I said, hematuria, blood in the urine, or lower back pain on just one side, rapid weight loss, not having an appetite, being really tired, anemic. All these are signs of kidney cancer. So for risk factors, there's a ton. Smoking, for one of them. Actually, people who smoke, they are twice as likely to get and die from kidney cancer. Same thing with obesity, they are twice as likely to die from kidney cancer. Environmental exposures, this means basically studies have been done showing that certain chemicals in the environment that people may work with or breathe in may be linked to the development of kidney cancer. Family history, this is especially important if you have a brother or a sister who have had kidney cancer, because that increases your risk immensely. Medications such as diuretics are also risk factors for kidney cancer. Gender, men are perceived to have a greater risk simply because they're more likely to smoke and they're more likely to work in environments with dangerous chemicals. For race, African Americans are more likely to develop it, and genetics, if you've it in your genetic makeup, you're obviously more likely to get it, kidney cancer. For prevalence, it's not too common in young people, but the average age is about 64, 65, and there's about 270,000 new cases each year. So there has been a ton of research. One of the studies I found shows that physical activity or exercise decreases kidney cancer mortality. So in this study, they basically just did a bunch of surveys and they collected data from people with kidney cancer who were not exercising and people with kidney cancer who were exercising, and they found that the mortality rates were higher for those who were not exercising. In this study, they also found obesity as a risk factor for mortality from kidney cancer, as well as smokers. Exercise also improves the quality of life. It can make one feel better mentally. Treatments and basically just having cancer can have a really bad impact on how one feels about themselves mentally, physically. So exercise has a way of kind of working against that. Exercise also could improve your functioning while on the treatments or medications, so really combating the adverse reactions that you may face. And there's also research that has been done that shows that exercise can prevent kidney cancer reoccurrence. So there hasn't been any clear-cut evidence showing that those with kidney cancer have a different training response to exercise. I just think it's just really important to modify the exercise intensity and modalities depending on the patient's capabilities, how severe their cancer is, the treatments they're undergoing, the side effects they're facing. It's really important to keep checking in on the patient to make sure that you're modifying it as necessary. It's also important when starting out an exercise program with someone with kidney cancer is to start and progress slowly so you don't overwork them. So for my case study, the individual that I have is a 50-year-old male with stage 3 kidney cancer, and he's undergoing a combination of chemo and immunotherapy. He does have experience in weightlifting, but he hasn't been active recently. He's reporting frequent fatigue and nausea, low muscle tone and low weight. He struggles with his appetite. As far as his blood pressure and heart rate, they seem normal. His BMI, it's within the normal range, but it is a little low. As he does that in his goals, he wants to increase in his muscle mass and his strength. Some risk factors that he is anemic, and he does have extreme fatigue. So for exercise testing for this client, I would want to get baselines of his strength, cardiovascular health, flexibility, balance. So for strength, I would do a 3 RM bench press and a 3 RM leg press. I wouldn't do a 1 RM just because he is untrained, he hasn't worked out, and he also has low muscle tone, so I don't want to get him injured or overwork him. I would do for a cardiovascular test, I would do a half-mile walk test, just record the amount of time it takes for him to complete it and monitor his RPE and any signs or symptoms that may arise. For flexibility, I would conduct a series of field tests measuring the flexibility of different joints, shoulder, trunk, joints of the lower body, more so. For balance, I would just complete a stork test. So for the client's exercise prescription, I would focus a lot on strength and aerobic, mainly strength because he said he does want to improve his muscle mass and strength. So for frequency, for both cardiovascular and strength, I recommend about 2 to 3 days per week, just so he doesn't get overworked, he doesn't get too tired. For the intensity for strength, once again, about 2 to 3 RM, 3 to 4 RM. I don't want to overwork him. He does have low muscle tone and he is untrained. For time for strength, I would start him off about 2 sets of 10, but as he progressed, I would add more weight and drop the reps to increase the intensity. For aerobic, I would, like I said, 2 to 3 days a week, about 65% of his VO2 max, and I would recommend that he do anything that incorporates large muscle groups. So walking, swimming, biking, anything that gets your heart pumping. For flexibility, and for cardiovascular, I also would start him out at about 30 minutes per day, but I would want him to progress to about 150 minutes per week. That's optimal. Flexibility, I would have him complete dynamic stretching prior to exercise and static stretching after. When he's stretching, it's important that he not feel any pain, just stretching to a nice slight tension, holding it for 15 seconds, and repeat. For balance will basically just improve as a result of the weightlifting, but I would also incorporate uneven surfaces such as walking on sand or using a Bosu ball just to really optimize the improvements in balance. For modifications for this client, like I said, it's really important to monitor his side effects of the chemo or immunotherapy. Like I said, depending on the person, side effects vary. Some people can get it really bad, some people don't get it at all. So it's really important to monitor him every day, ask him how he's doing, ask him if he's feeling worse or from the exercise, better from the exercise, if he is feeling really dizzy, all these, everything that is could be potentially a risk. You should monitor those. Also, since he is on chemotherapy, I would monitor his blood work just to make sure his platelets and red blood cells aren't dropping too low, because that can make him feel faint, can lead him to passing out, which you don't want that. And then like I said, I would progress him slowly, start off slowly. I would start off with exercise bands, light weights, and I would also supervise him, especially at the beginning, to prevent any injuries or overworking or anything like that. And any other doubts that I would have, I would consult the physician. So if I didn't know if an exercise was appropriate, or if he would have any issues doing something, or if the physician wants him to work on certain things, it's really important to be in contact with the physician to kind of work together to optimize the patient's health. So that was my presentation on kidney cancer. Thanks for listening, and